Greetings, my name is Dr. Kari Ann Hong, and I'm a general dentist here in Thousand Oaks, California. I have staff members that are on call for me 24/7 to answer the phone, so if you have a dental emergency, you'll get your needs answered as quickly as possible. The biggest concern that we have for patients, the biggest emergency that can occur, is when there's facial swelling. Facial swelling is usually a sign of a dental abscess. And a dental abscess means that there's infection in the tooth area that's spreading to the bone. This is a very serious dental emergency. And if you were to call us and we were not to answer right away, we actually recommend that patients go to either an ER or an urgent care to get the proper dose of antibiotics prescribed to help with the swelling. Because the inflammation that occurs with an abscess and the swelling that occurs into the bone could be life-threatening. So that's really the biggest dental emergency out there. A second emergency that I would say is a very urgent need in terms of needing to see a dentist right away is if you get a tooth knocked out. So let's say you're playing a sport and you get hit in the face, or riding your bike and you fall over the handlebars. If you knock out a tooth, you need to see a dentist within the first 30 minutes to an hour to try and get that tooth reimplanted in the socket. After about an hour time frame, there's not a really good chance that the tooth will actually be able to reintegrate with the bone. But if you're able to get it reimplanted in those first 30 minutes to an hour time frame, there's a good chance that you might actually be able to save the tooth for the long term. What you do if this happens to you is you want to take the tooth and you can either leave it in your mouth or put it in a cup of milk, and you want to call the dentist that is closest to you and go into their office and have them put it back in the socket. So if you ever have an emergency like that, you really just need to find the closest dentist to your location and see if they can see you right away to put the tooth back. The other emergency that I would say is a pretty big deal for most patients is if they break a tooth. So if they're out and about and something happens where they either fall or they bite on something and a tooth chips, that's a pretty big dental emergency for most people. And oftentimes it's a pretty easy fix. If you break a front tooth, usually we can do some simple tooth bonding right on the spot to fix the problem. If you break a crown or a tooth, usually there's some emergency procedure we can do to get you by until we're able to address it on a more extensive basis. Because sometimes if you break a tooth in the back of the mouth, it'll need a crown or a different type of procedure than bonding. But usually there's something we can do to kind of get you out of pain, out of discomfort pretty quickly. And then probably the most common emergency that occurs in my practice is someone calls and says that they're in pain. Your tooth's been hurting for a while, or they're having some symptoms to hot and cold sensation with the teeth. And we can always usually see our patients the same day, even brand new emergency patients. So if you have a specific emergency concern or need today, please give our office a call directly and we can help you out. If it's something that you think can wait a while, you can also contact us online on the Contact Us page. But probably the best way to reach us is to give us a call, and one of my staff members would be happy to assist you.